Hello, and thank you for joining us for another webinar session here at Senior Health Medicare. Today I have Cameron Giardini and Colleen Bringman. They're going to teach us how to choose our own Medicare Part D on Medicare.Gov without any help from anybody else. So we'll let them take it away. Colleen and Cam.
All right. Hi, I'm Cameron, and I've been in the Medicare business for a couple of years now and at Senior Health Medicare for about a year. So Colleen and I.
Hi, everyone. I'm Colleen Bringman. I'm the department head of the prescription drug plans. So if you do have any questions during this, you can always call Senior Health Medicare and ask for the Part D department. I'd be happy to help you guys out.
Yep. So Colleen pretty much is the Part D department. So if you call, you're going to find her. And we just wanted to go over a discussion today about how to confidently find your own drug plan on Medicare.Gov. This is really important every year to do during the annual election period. Really, I've seen a study before where 10%, you're going to actually spend 10% more on your drug coverage every year if you don't shop your plan. The reason for this is that plans change their formularies, your drugs change that you take. A lot changes every year. So it's a simple process. It takes about 5 to 10 minutes on your end and another 5 to 10 minutes on our end, and it's something that can save you a lot of money over time. So we just wanted to make this tutorial to show you how to do it. And with that being said, we'll just dive right in. So when you're looking for a drug plan, you're going to use Medicare.Gov, which is the official government website. So you just log right into that. You can either go on Google or just type it into your search bar up top. And then after that, once you get to Medicare.Gov, the website, then you're going to want to click on the green Find Your Health Plan or Find Your Health and Drug Plan tab. So you're going to see that where the arrow is pointing to. And then once you do that, it's very simple. You just put in your zip code. And then it's going to make a more customized search. You'll see where this comes into play later on. Then it's going to start asking you some questions. And I know it looks like there's a lot here, but really, most people, what you're going to put is, I don't know what coverage I have, and I don't know, or is the state paying for your prescription drugs. The reason we do this is because it really doesn't affect much whether you say you have original Medicare or you have an HMO or PPO. It's just easier to go through this process. However, I will say, if you do get help from Medicaid, make sure you click that button because it can change everything about your drug costs. The state will pick up a lot of your costs, so a lot of the numbers won't be accurate if you don't put that. And Colleen's a real expert when it comes to drug plans. I'm more of the general person here when it comes to that, so I wanted to send it over to her for all the technical details.
Thanks, Cameron. So once you enter in your information, you're going to be taken to the page where you will begin to enter your drug list. So you will be able to type in the name of your medication. Once you type in the name and click Find, the box will pop up and you'll be able to select your dosage amount, how frequently you take it, and the quantity that you get, and if you use a retail pharmacy or mail order. Now, it's very important to be as accurate as possible because capsules are more expensive than tablets. Mail order is sometimes not as expensive as retail. So you just want to be as specific as possible for what you are looking for and the medications that you are on, as these plans are catered to you and your drug list, not your wife, neighbors, brothers, or sisters. Once you put in all of the medications that you are on, you will see at the section right next to where you're typing in the medication, it will create your drug list ID and password. Now this ID and password will make it so your drug list is saved on this site, and you'll be able to edit it each year during the annual election period, whether it be you need to take medications off, add new medications, change your preferred pharmacy, so on and so forth. And later on in this webinar, we're going to show you how you can put those back in and look at it again and make changes. But moving forward, once you complete your drug list, you can click on My Drug List is Complete. After you click on that, it's going to take you to the pharmacies that are near the zip code that you put in. Now, it's in alphabetical order, so if you don't see the pharmacy that you like, there's a drop down for the miles, how far away it is from that zip code, and you'll be able to find the pharmacy that you prefer, whether it be Kroger, Myers, Walmart, so on and so forth. You're able to select up to 2 pharmacies to look at and compare the pricing, and in this comparison, it automatically adds mail order for you. So you can do up to 2 retail pharmacies, and then mail order is already added. Once you pick your pharmacy, you can click Continue to Plan Results. Now, once you click on Continue to Plan Results, you want to select the box next to Prescription Drug Plans with Original Medicare. This is going to show up all of the prescription drug plans and not have all the confusion of the Medicare Advantage plans mixed into it. Once you select that box, go ahead and Continue to Plan Results. When you get to Plan Results, it's going to pull up the 23 different plans or so that are in your area. You want to sort the results by the lowest remainder of the year retail cost, or if you prefer mail order, you can select the lowest remainder of the mail order cost. Use that drop down to what you are specifically looking for. Now, with this, you want to look at the premiums that are going to be showing and kind of the overall general information of these plans. To get a further in-depth description on it, you want to click the box next to the plan name. You can select up to 3, and that will go ahead and choose the plans and compare them side by side for you. So once you select the box next to that, you can click Compare Plans. When you are in Compare Plans, it's going to bring them up for you. It'll have it, like I said, side by side. It'll break down the monthly plan premium, if there's a deductible. It also will show you what tier your medications are on, how much you'll be paying each month, and so on and so forth. And if you would like an either further description on the plans, you can click the plan names, and it will break down what you'll be paying at the pharmacy, what is going to premiums, so on and so forth. They'll have a graph for you that way too. Now, if you are satisfied with the list that you added in and the companies you chose and you want to save this information for later, the best way to do this is to print the comparison report. It's at the bottom of the page, and this is the way that you are able to save this or print it out and save for your records so you can discuss it with your significant other, mull it over for a little bit, or call your agent. You can also call us at Senior Health Medicare for better information and a full breakdown on what everything means. There is a vast amount of information on this site, so if you are having confusion, go ahead and give us a call. The next slide is just kind of going to show you how it's going to print out or how it's going to save. Then I'm going to pass it back over to Cameron, and he's going to do a little bit more with you guys.
All right, so Colleen did a great job of talking about all the technical aspects of it. I'm just going to talk about why it's important to go through these drug plans every year, and it comes down to whether you need to make a change on the plans, whether you got a new drug, are drugs discontinued. A lot can happen with these plans, so as she showed you earlier, where each drug has a different tier in a formulary, you could change those every year. So your Tier 1 simvastatin might be a Tier 2 next year for the company that you have. So it's important just to make sure each company you're looking at has the best tiered medication. There's a lot to look into, and most of this tutorial is just to give you added confidence. So you can look at it and know that the plan that you're getting is the best one for you. It's also because we know that not everyone wants to give us a call and talk on the phone for 10 minutes. So this allows you to look in your own living room with your husband or significant other, wife, and then you guys can go over the plan separately. Then when you think you've come up with the right plan for yourself, you can just give us a call and we can help you with the easy enrollment process. Or if you're already on the right plan, it gives you comfort knowing that your plan is still the best plan for you. And then we just want to go back. Colleen showed you earlier where you have the drug ID and the password date. This is really important. Make sure whenever you're doing this, write down your drug ID and password date, because when you call Colleen telling her that you found the right plan, or if you want to look at different plans, give her that date so it pulls up your medications right away. And what you're going to do for that, if you want to do it on your own too, to look back at it, you can go back to Medicare.Gov, just like you did at the very beginning. You go back to Find Health and Drug Plans. Then you go, same thing, zip code, I don't know, and I don't know, like I said, unless you have Medicaid, so make sure you look at that. And then this is where it gets different. So instead of typing in the name of your drugs like you did before, you are going to go to the drug list ID and password date on the right-hand side. And then the one that you wrote down, the drug and password date, you're just going to input that right there and do Retrieve My Drug List, and that will pull up all your drugs just like you had it before. So right here you see it pops up. You had your drug list ID, your password date, and all the medications you were taking. Now if you want to look at the plans, you just continue further with that and you go to find drug results, the plan results, and you can keep comparing plans every year just to make sure you're on the right plan and you're saving the most you can. And that's pretty much it for the tutorial. So, is there any questions as to why it's important to do this every year?
One question came in, but I think you guys answered it, but we'll give it another stab anyway. Is there anyone that can help if they don't want to do this on their own?
Colleen.
The Part D department here at Senior Health Medicare, like Cameron said, I'm kind of the sole person here, so you can just ask for me or ask for the Part D department. I'd be happy to help you out. If you're not in your open enrollment period, the next time that you can look at these plans is the annual election period, which we are coming up here October 15th through December 7th. So I'll be happy to go over the analysis with you, do the comparison, and just make sure that the best plan is getting recommended to you. I also want to make a statement saying that even if it is the cheapest plan for you, it might not be the best plan for you, as there are other factors that you need to look at, such as the star ratings, your pharmacy being in a network, so on and so forth. So if you are getting a little confused, go ahead, give us a call. We'll make sure everything works out for you and be the best for the next year.
Excellent. Thank you very much, Cameron and Colleen. And for a more detailed description of actually what Part D is and some of the things Colleen just brought up at the end, we do have another webinar session titled Part D, the Prescription Drug Benefit. So check that out on our website. That's www.seniorhealthmedicare.com. And if you our 1-800 number is there as well, so if you need to get in contact with Cam or Colleen, we're happy to help. Thanks, and have a great day.